the way we service our customers, all those things are important. So I'm going to answer that question by telling you a little story. And I wish I had more time. I'd love to do this talk over 2 days. All this stuff about AI and machine learning, and all these Gartner reports, the Gartner hype cycle, all these things we hear, is very exciting. From a healthcare point of view, it's super exciting. Until this happens. 10 years ago, I stood at the bed of my mother dying. That's just a picture from the internet, it's not her. She obviously didn't take pictures while she was there. She had bone marrow cancer, 8 months since diagnosis. And as a family, and I presume some of you may have been through something similar with family members. I think it's different if you're a healthcare practitioner and when it's your own family member, I would assume. But it was something that nothing has ever prepared us for. Because you don't really know all that much about cancer. We didn't understand the diagnosis. First they thought there were problems with the bones, with the knees, 2 knee replacements, shoulder replacement, and eventually they discovered it's the bone marrow. Her mother, my grandmother, was in the same oncology ward, dying from lung cancer. And they died 3 days from each other. So I wish we had a better customer experience, if you would, as the family of somebody who was dying. The admission into the hospital was a mess. Paperwork, then losing the paperwork. Us looking for information that we don't even know where we had it anymore. The dealings with the doctors and the medical staff, the access to information, all the way through to the passing, and then figuring out where are the policies and what was she insured for, and then the funeral arrangements, all of that. It's different when it comes to this topic than when it comes to the fact that you're a banking client. Yes, it's your money, it's still very personal, but you know, if the bank drops you a little bit, if the mobile app doesn't work and you can't do your banking, it's a one thing. But when it comes to death, it's closer to home and more closer to our most primal instincts than anything else. So the one thing I would like to leave with you today is this. When you think about this kind of technology, and when you think about utilizing it in your practices and your businesses, if it does not serve your patients, if it does not serve humanity, then what are we doing? Yes, you'll hopefully make more money. You'll hopefully bring down some costs. You'll hopefully find access to new markets. Those are relevant things. But let's see how we can serve people, serve others when it comes to AI. So think about, if you would, almost the end-to-end process when it comes to dealing with your customers or dealing with your patients. A lot of us don't have that process even properly defined or mapped, most likely not even automated. So you can't just go and put AI on top of that. The fundamental business process in that patient walking into the hospital, the whole process through, do you understand it? And do you understand how, for instance, capturing their data once, or not even capturing it because you should have it somewhere already. And what can you take away from this family and this patient that is in this despair, not to have to go through all the paperwork and the documentation and phoning the doctors or the practice over and over again trying to get information. So think about that. This is what AI will not be able to do yet. We don't know if it will be able to show empathy. Again, when I'm a banking client like all of you, I'm happy not to go to a branch because it's a waste of time and I don't want to stand in queues. But if tomorrow all the money from my bank account disappears, I sure as shit want to go speak to a person. Okay? I don't want to speak to a call center, I don't want to speak to a chat bot. I want to look somebody in the eyes and find out what the heck is happening. The more so when it comes to healthcare. Yes, if you have predictive analytics and you can show through my Vitality program or whatever that I did my Vitality age the other day, it was a bit of a shock, so I'll get back into gym. But it's good to know that based on my lifestyle, this is possibly where I'm going. But when the doctor tells me I've got cancer and I've got 3 months left, I wouldn't want the chatbot to do that. I would want to look somebody in the eyes and say, is there hope? And potentially hold my hand, especially if I lie dying. I don't want it to be a super intelligent computer or chatbot that will know 1,000 times more than the doctor. I want to have a human being whose hand I can hold and who can guide me on this process of passing. I think we need to go for whiskey after this talk because you all look very depressed. Okay. We all hate this, standing in queues, waiting. So if you look at the customer experience, or CX, In a lot of businesses, we're thinking about that. For me, the topic I'm talking about today is very relevant to customer experience, but again, it's so much closer to home because it's your health, it's the health of your family, it's the passing of yourself or your family members. It's a lot more personal than standing in a bank queue. If you're stressed because you don't know what's wrong, or the doctor gave you a diagnosis that's shocking, you don't want that, whether it's a call center or standing anywhere in the queue. Okay. From a business point of view, I alluded to this already. Make sure you understand your processes before you even look at this kind of technology. Robotics is not AI. I hope most of you know that. A lot of people think we're now doing robotic process automation. It's a great thing to do for your back office, your repetitive kind of tasks. It's fairly easy if your processes are mature to do this, fairly cheap. But if you don't understand your processes, don't even look at AI. Again, how do patients or customers come into your business? Social media channels, phone calls, referrals. Do you even know what all of those are? You have to map it out. Here's the source of all the people that could be in contact with me. And then how do you automate that process straight through? And what is that process? So it's an important thing before you even start looking at very smart things and robots flying around to understand your processes. Previous speakers spoke about data, and I fully agree. In my experience, the single biggest problem that customers that I deal with face is their data is immature. The data is all over the show. They're not compliant to GDPR or POPIA, and even that will finally be a real thing. You know, I mean, right now, from a GDPR point of view, you know, the data regulation in the EU, I should be able to ask for my data back. Imagine you walk into the bank branch now and you say, can you please tell me where my data resides in your organization? Which machines, which servers, where in the cloud or wherever. And can I have it back, please? We can't do that. So how do you capture the data once without asking people for this stuff over and over again? Let me give you an example. It doesn't happen that much anymore. You know, if you change your contact details with credit card at your bank, it doesn't reflect through to home loans necessarily because they're all on disparate systems and they're busy changing that. Different products and services that you'll be interested in from the bank. Policy perhaps toward education one day, and so forth. So what lifestyle changes are happening through your interaction with your patients and your clients, and how can you, through predictive analytics and machine learning, offer them even better services and products that they might not even have thought about needing. For me, it just goes back to the admin side and all the work and all the paperwork. Getting back to data acquisition. An AI strategy can only be built on top of a proper data strategy. So, and I cannot stress this more, and I hope it comes out through all of today. Think about the data that you have on your vendors, your clients, and your patients. Where is that data? Is it mature? Is it secure? Data leaks, things like that, which is so easy when it happens. We'll look at what happened now this last week. You know, it's so easy. Don't fear the cloud. Please, can I leave you with that message as well? The cloud is such a stupid name we gave it. For me, the cloud sounds like something there. So here's all my client data. I don't want my competitors to have it. I'm going to send it through Azure or through Amazon in the cloud. It's just somebody else's computer sitting somewhere else, ultimately. But utilize that kind of technology. Don't fear it. The cloud is most likely more secure than any on-premises solution you might have at the moment. Predictive analytics, again, from a business point of view, to be able to service your clients better, to predict what kind of costs are going to come your way. But from a healthcare point of view, again, to be able to predict where people's health is going. You might have seen that Elon Musk has invested in this company, I can't remember the name now. They're looking at implants into our bodies. Massively controversial topic. So let's look at the two sides. I, on the one hand, don't want an implant from a privacy point of view for starters. I don't want you to be able, or anyone, to be able to figure out where I've been. But we're going to get to a point where that implant might even pick up what I'm thinking. So imagine you live in North Korea. It's one thing to call the leader, what do they call him, the big leader, supreme leader or whatever, but they make him like a very lovable, wonderful person. It's one thing to fake it, and behind the scenes to actually hate this person. But what if the government can pick your intent up through an implant? I've got a 5-year-old son, let's look at the other side. God forbid he ever disappears. 1 out of 4 people in our country is a victim of human trafficking. I would love for him to have an implant so we can track him immediately. I would love to have an implant that can predict if there's cancer in his body. So can you see, if we come back to the philosophy and the ethics side, the potential good, the potential bad of this kind of technology. My personal view, because I'm not a criminal, I don't do things wrong, I actually don't mind if you know where I am and what I'm doing, for that matter even what I'm thinking. I really would love to know I'm getting sick a long time before it's too late. And I'd love for you to find me if they come and abduct me or something like that. So we're going to have to make these decisions. So can we use the data on our clients to better serve them and give them advice? It's a topic called cobotics. I don't know if you've ever heard that. So think again about diagnosis for that matter. There is a lot of accuracy using machine learning and image recognition when it comes to diagnosis, especially scans of lungs and things like that. It's much better than any doctor to pick up the diagnosis. But and you refer to it, you get this in the news where the AI makes mistakes because AI is based, we made AI, so can you imagine that it will be without mistakes? So if that technology can help my doctor diagnose something quicker, it would be great. I still want him or her to be there to tell me what's wrong and to guide me through it. So.